We find ourselves thrust into extraordinary times. Less than 3 months ago, Canadians were celebrating the holidays, largely insulated from the problems of others. Now we find ourselves facing a kind of a surreal threat in the coronavirus, COVID-19. And we're thinking through how are we going to navigate these uncertain waters. To do that, I reached out to a friend and colleague of mine, a Harvard doctor and professor of public health, Dr. Michael Rich. Dr. Michael Rich is a practicing pediatrician at Boston Children's Hospital, an associate professor of social and behavioral sciences at the Harvard School of Public Health, and a professor of pediatrics at Harvard Medical School. Welcome, Michael.
Thank you.
I wanted to ask you 3 questions. The first is, what should I say to my children, or what could teachers say to their students about the coronavirus? Then I'm going to ask you what we should do. And then finally, I want to ask you how we might get through this. So to start out, how might we talk to our children about COVID-19?
Well, you're absolutely right. These are extraordinary times. And it's long been said that extraordinary times give rise to extraordinary people. But what we should remember is that those extraordinary people were ordinary people until those extraordinary times, where the demands forced them to step up. And we can all do that. And the way we do that with our children is to be truthful, to speak to them in truth, what we know and what we don't know, but speak to them with confidence. And perhaps as importantly, listen to them, answer their questions, let them know when we know the answer, let them know when we don't know, and not talk about this with fear, but with caution, because we can defend against the unknown with the known.
Well, I think, being truthful means that we have to understand what we know and what we don't know. So can you help us to communicate that to our children? What do we know and what don't we know?
Well, I think we keep it simple. Wash your hands. Cover your mouth and nose with your elbow when you sneeze or cough, and then wash your hands again. Don't touch your face. Clean surfaces that are frequently touched, like countertops or doorknobs, and save the limited supply of face masks for those who really need them. Face masks do little to no good for uninfected people, but they do great good if they are covering the respiratory droplets that are being expelled by those who are infected. So save them for those who are infected or presumed to be infected, and for the healthcare workers, because frankly, personal protective equipment is at short supply in our hospitals and our medical offices right now. So these are the key things. And ultimately, if someone is sick, don't figure this out on your own. Get them to medical advice, get them to medical help, and get this determined if they need to be tested or not, if they need to be treated or not.
So I think that's really important. In Alberta, we've been very lucky. Our chief medical officer and Alberta Health have been giving us very clear information. I think it's important for people to know that in our conversation, this isn't intended as medical advice. If people think they have a medical emergency, they need to call their doctor or emergency services immediately. It's really important that we make sure that people are safe, follow the advice of trusted doctors that are in their communities, or in our case, in Alberta, the chief medical officers. So with that, let's maybe just talk about truth and fantasy, because there's some really interesting things that are circulating right now about COVID-19.
Well, I think as we approach this, we should also directly address what we don't know. And the key thing that we don't know, among all of the information about the natural history of this virus that are still unknown, but the key thing on a practical basis that we don't know is we don't know who might be spreading it. Because we do believe that people who are asymptomatic, that is without a fever and a cough, may already be infected and spreading the virus without anyone knowing. So we have to behave as if everyone is infected and potentially spreading it. And that's why we have to keep our distance from each other, our physical distance from each other. This is not so that we are fearful of each other, but so that we are cautious, because any of us could be unsuspecting carriers of this indiscriminate virus. And then I will speak to the truth and fantasy piece, because we're in a unique time when we don't really know who to trust. We have done a really good job of helping our kids understand how to be critical thinkers and how to check the sources. But we have everyone from leaders of our governments right through to purported healers who have cures offering sauna or saying that the vaccine is right around the corner. And these things are not true, and we cannot depend on them. So it's really important to rely on folks like Alberta's chief medical officer, who are giving you hard facts that are not necessarily what you want to hear, but what you need to hear. And I think that what we really need to do is understand that the only thing that we can control is our ability to stay uninfected and to stay out of that rising peak of number of people who are becoming infected, and that threatens to overwhelm our medical system. And ultimately, as we approach this issue of really understanding who to depend on, who to rely on, I go back to someone who is a mentor to me at a distance, Fred Rogers, Mr. Rogers' Neighborhood, who would deal with even very difficult things like a death in the family or a divorce and explain them to children in ways that did not frighten them. And the key thing he would always say is, look to the helpers. Look to those who are helping to fight back against this virus. Not just the doctors and nurses who are on the front lines, who we owe a deep gratitude to, but to all of the helpers, including the people who are driving the delivery trucks, who are bringing supplies from food to medical supplies to places, to the custodians who are cleaning our schools and our stores and our workplaces, and to even the children who are helping each other. And this is ultimately something we can give to our children, which is, instead of waiting around for someone else to swoop in and help us, reach out and help someone else, someone you love, someone you don't know, because in the doing of that, you are helping not only them, but yourself.
I think that's really important advice, especially as we know that this is a local and global pandemic. This is something where young people, when they're sheltered at home or when they're with their families, they can start thinking about how they can become the helpers to support those that are staying at work in hospitals so that we can be safe in our homes. I think this notion of becoming helpers so that they feel less helpless as young people, and talking to them about ways that are physically distant but socially connecting in positive ways, that's important. Thank you, Michael, so much.
You're welcome.